My character is Eleven from Stranger Things. Eleven was born telekinetic, which means she can move basically anything with her mind. After her mother has given birth, she was taken away from her. So her whole life she lived at National Laboratory in Hawkins, Indiana. The reason she lives there is so the scientists can use her as a test subject to develop her psychokinetic skills. Eleven has developed many disorders from being in Hawkins Laboratory. One of the many disorders is PTSD. PTSD is an anxiety disorder that develops in relation to an event which creates psychological trauma in response to an actual or threatened death or serious injury. She developed this soon after she escaped from Hawkins Laboratory. Next disorder, we have anxiety. Excessive anxiety and worry occurring more days for at least 6 months about a number of events or activities. For example, there is a scene where Eleven has to hide in a closet, and as the door shuts, she starts to panic. Soon after one of her friends opened the door, she was hysterically crying. Next, we have claustrophobia. It is a form of anxiety disorder in which having no escape or being closed in can lead to a panic attack. Another example in the same scene as anxiety, she has a flashback of when she was at the laboratory and she was being punished for something. So they threw her into a room, locked it to where there is no way out. Panic disorder is based on the experience of recurrent, unexpected panic attacks in a person's lifetime. An example of this would be a scene in the show where she was using her telekinetic energy. She had a panic attack and opened up the gate to the upside down. Schizophrenia. Symptoms of schizophrenia are delusions, hallucinations, disorganized speech, or catatonic behavior, and negative symptoms. The course of disorders began when scientists kidnapped her to use her. They taught her how to use her powers, and after she escapes, her powers grow. An estimated of 70% of adults in the United States have experienced a traumatic event at least once in their lifetime. An estimated of 5% of Americans, more than 13 million people, have PTSD at any given time. Almost 7 million of people suffer from general anxiety disorder. 15 million people suffering from social anxiety disorder. Some estimates say about 2% of people suffer from claustrophobia. Panic disorder. Anxiety disorders that are most common mental illness in the U.S. It is affecting 40 million adults age 18 or older, or 18.1% of the population every year. Anxiety disorders are highly treatable, yet only 36.9% of those suffering receive treatment. 1% of the population is diagnosed with schizophrenia. About 1.5 million people will be diagnosed with schizophrenia this year around the world. PTSD. PTSD has a lot of causes, and some of those causes are war, domestic violence, sexual, physical, and emotional abuse, death, and more. A range of factors can work together to cause anxiety disorder. People with anxiety disorders regularly have genetic predisposition towards and physical favors, such as imbalance of hormones and chemical messengers in areas of the brain, also play an important role. Claustrophobia can be related to dysfunction of the amygdala, I can't say that word, which is part of the brain that controls how we feel. This phobia can be caused by a traumatic event such as being in a tight crowd or space for a period of time. Now moving on to treatment. Several scientifically proven and effective treatment options are available for children with PTSD. Cognitive behavioral therapy helps kids recognize their thought patterns and identify where and when those patterns help and hurt. Who discovered cognitive behavioral therapy? It was pioneered by Dr. Aaron T. Beck in the 1960s while he was a psychiatrist at University of Pennsylvania. Types of treatment. Several scientifically proven and effective treatment options are available for children with anxiety disorders. Two treatments that help children overcome anxiety disorders are cognitive behavioral therapy and medication. Cognitive behavioral therapy. Learn to identify and replace negative thinking, patterns, and behaviors with positive ones. Learn to separate realistic and unrealistic thoughts. Will receive homework to practice what is learned in therapy. This is the same treatment as the last one, so I just put the same slide but in two different places because Medication. Selective serotonin reuptake inhibitors. Antidepressants. They are antidepressants that are also commonly prescribed to treat anxiety. They improve mood by blocking the reuptake of the neurotransmitter called serotonin. Types of treatment for claustrophobia is flooding. Flooding is a form of exposure treatment where a person is exposed to their phobia trigger until the anxiety attack passes. Description. Who discovered flooding therapy? It was invented by psychologist Thomas Stampfel in 1967. First session will last several hours, but later on they get shorter. Types of treatment. Several types of medications have been shown to be effective in managing symptoms of panic attacks. SSRI antidepressants are typically recommended as the first choice of medications to treat panic attacks. Description of the treatment. It was discovered by Klaus I'm not even going to say the last name because I don't know how to say it. He's most famous for his work in organic history, which led to his invention which he also founded Prozac. Types of treatment for schizophrenia is risperidone. It can treat schizophrenia, bipolar disorder, and irritability caused by autism. Description of the treatment. It takes about a couple weeks for the medicine to work. The symptoms is heartburn, dry mouth, increased saliva, and increased appetite. And this is my and then this is my